And I'll put it live on Facebook, so I don't know if some people might have been. Oh, it's just loading up.
All right.
Cool, take it away.
Okay. No problem. Okay, well, good evening, and thank you for sparing your time to listen to this webinar. I am sharing a screen here, so I'm not looking directly at the camera, just forgive me for that, but I will answer any questions at the end and face camera straight on. I hope this webinar will offer some interesting listening that in turn generates questions from you all. Having read my bio, you'll know my name is Alan McCarthy. My current role is looking after product development and quality assurance for IMS Euro, alongside some other hats that I need to don now and then. I have worked with IMS Euro for approximately 8 years, following my career with AstraZeneca Pharmaceuticals. During my time in corporate pharma, I worked across several project areas, including oncology, drug metabolism and pharmacokinetics, safety assessment, really focused and specialised in sort of drug delivery systems that would then be advanced to the human setting and subsequently veterinary medicine. So from today's session, I hope to introduce what I consider to be a revolutionary development for blood hemostasis, emergency trauma, planned surgical procedures, and routine bleed control in animals and human medicine. Chemical or natural blood hemostats are routinely expensive. They can be difficult to apply and may also need to be removed following use due to potential contraindications. Therefore, they are only considered and utilised for emergency purposes in both human and veterinary applications. Today's learning will be focused on a revolutionary new product that will hopefully change the way we consider and use blood hemostats in the clinical setting. The manufactured names for this product are now set as Collaclot for the veterinary market and Clotter for the human application. These products have been developed by the country's leading collagen scientists and professors, and the manufacturing process is based within and outside of Cambridge University. The scientific knowledge and involvement behind this project was only made available if the products in question were produced would directly benefit humans and animals as a new medical device to provide life-saving opportunities, first aid support for wound management, and not aligned to the areas of use involved with cosmetics or beauty therapy. The resulting product is extremely exciting and is also generating serious interest from some of the country's leading surgeons, the military, first responders, and medical professionals due to its benefits and USPs across multiple applications. So Collaclot. The USPs for Collaclot over the competitor products are numerous. The cost is one, the ease of use and the speed of activation or efficacy are possibly the most relevant for daily use within a veterinary surgery over and above any emergency use as currently. This is when most hemostats are only considered. Personally, I would like to see the routine use of Collaclot in a vet surgery for general bleed control situations like dentals, bite wounds, ear hematomas, nail and pad cuts, and any surgical requirements where an unexpected bleed occurs. This in turn would lead to a reduction in the time required for a vet or nurse to control the bleed, reduce the surgery time per patient, and consequently the volumes of anaesthesia required, which furthermore would promote a faster patient recovery and wound repair process. Medicines and medical products like this routinely take the R&D route through human medicine, and this usually involves lengthy and expensive preclinical and human clinical trials, followed by the MHRA submission, scrutinization, and full approval process. If approved, and often following several years within the trial processes, a and human healthcare settings, these products generally transfer across to veterinary medicine. So the development of Collaclot veterinary haemostat and Clotter, the soon to be launched human haemostat, allows for a very different and exciting opportunity for the veterinary profession. This product is so new to market, it has been launched within the veterinary sector during the ongoing human approval process to help generate in-use animal data and case studies to help support the human submission and hopefully approval. Hopefully this will speed up the product approval and in turn save many lives and improve the welfare of animals and patients around the world. Additional support and collaboration to progress this product into human medicine is currently ongoing from the only 3 professors of trauma injury in the UK. This is Professor Sir Keith Porter. He's a professor of clinical traumatology in the Queen Elizabeth Hospital and West Midlands Trauma Unit. We have Professor Mansour Khan, consultant trauma surgeon and clinical professor of trauma surgery at Brighton and Sussex University. We also have Professor Karim Brohi. He's a consultant trauma surgeon at Barts Hospital and professor of trauma surgery at the Queen Mary University of London. The above endorsements and recognition to promote and use these products in humans is from the highest level and can only be seen as huge kudos to the scientists and the manufacturers of Camcol Limited, the manufacturers down in Cambridge. So, what is collagen? Collagen is abundant within mammals and is the most prevalent protein in the body. It's fair to say our bodies are effectively built on collagen. Its composition resembles a fiber-like helix structure similar to that of DNA, used in to manufacture connective tissue, and is also a major component in bone, skin, muscles, tendons, and cartilage. So collagen and wound healing. Collagen plays critical roles in the regulation of various phases of wound healing. Collagen exposure, as a result of an injury, activates the blood clotting cascade, resulting in the formation of a fibrin mesh network. This is the clot that slows and stops the initial bleeding and later becomes a scar to protect cell regeneration beneath. Collagen also contributes to the mechanical strength and elasticity of tissues and acts as a natural substrate for cellular attachment and proliferation. So applying collagen to a wound can promote wound healing by the following processes. Number 1, it can abate the inflammation. Number 2, it aids the migration of key cellular components of wound healing. Number 3, it promotes an anti-inflammatory environment and restoring progression into the reparative stages. And number 4, promotes granulation tissue and re-epithelialization, basically cell reproduction. So Collaclot and Clotter. The 2 products are a natural 100% UK avian-derived collagen product. Avian collagen is one of the closest matches to any known collagen when compared to the human protein. So avian collagen used in these haemostats is a natural byproduct from chickens' feet. And they possess the highest yield of quality collagen when compared to other collagen donor species like bovine and porcine options. This is due to the age of the byproduct, the chicken's feet, at retrieval for processing, and therefore allows the raw material to be sourced in a cost-effective manner from fully traceable sources within the UK. This then reduces air miles due to the geographical market availability, and consequently the CO2 impact when compared to other collagen sources that already have strong markets for their respective byproducts, for example, cow hides and cow skin or pig skin. The manufacturers can also produce a halal version of the product recognizing the needs of ethnicity, where bovine and porcine collagens would not be considered. We have already established that Collaclot has been developed and is solely manufactured in the UK. But now I would like to share some information on why this is possibly a best-in-class product across all veterinary and human haemostats currently available on the market that can be used across multiple applications. In front of you, you see these the slide there, these lab-based experiments. The blood tests. This test has been developed in-house to provide comparison data across marketed haemostat products. Celox is the main competitor and currently the best seller on the market. As you can see from the test tubes, within each test tube is a gauze swab on the lower side. Yeah, that one there. Is a gauze swab. This is clearer on the Clotter test tube images on the left. You can see the gauze swab underneath the blood. And just above the gauze swab is the haemostat product. And then decanted onto this is a volume of non-anticoagulated fresh human blood. The test is essentially a reverse of how you would observe a wound. First, you would see blood at the wound site. Effectively, you then place a swab onto the wound. So the only addition at this phase would be the haemostatic sponge. This reverse lab test allows us to observe blood essentially soaking through a swab, as would occur in a normal wound scenario. The purpose of this lab test is purely to show how blood reacts with the Collaclot clotter sponges and promotes clotting during this contact phase. You can see that the Collaclot and clotter product effectively controlling blood flow, and the images to the right are the product's main competitor, namely Celox gauze. Now the difference is obvious. Once absorption from the Celox gauze swab is maximized, the product allows seepage of blood directly through it. So it isn't developing any clotting formation, but acting only as an additional plug within the wound. The clot formation, on this slide, we can see the clot formation from both products. So the top bit, the Celox clot. So the jagged nature of the Celox gauze is not conforming to the wound architecture or showing any extension of gelling. Any physical movement in respect to this wound would move the product and more likely generate a rebleed, causing another problem to deal with. In comparison, the clotter format below shows an approximate 5 millimeter extension of a definite clot formation above the product. You can see, I think there's an arrow on the large image on the right. So this is the clot formation above the sponge, which is a minimum of about 5 millimeters. In a human setting, in a trauma setting, a surgeon will be happy to receive a patient with this type of clot formation and the cessation of blood loss at this site. So now we've got a case study that came through towards the end of last year, and the benefits of Collaclot for veterinary use. As you can see, this is a significant injury sustained by a horse that was treated directly with Collaclot and held in place until the vet arrived. Following the cleanup and prior to stitching, it was unexpectedly observed that there was no additional bleeding following the product's removal during the cleanup and also during the stitch staple process. You can also see from the images that a gravity fluid drain, the unstapled area at the base of the wound, was left there as a precaution to remove any excess fluids. This was not actually required, and no additional or excessive fluid buildup or secretions were observed throughout the whole process. The attending vet was extremely impressed with this, but also understanding wound treatment in horses especially, they were expecting this particular wound to break down within the days following. Again, this didn't happen. The wound repaired beyond their expectations and was almost unrecognizable within 2 months, and the horse fully recovered from this episode. So the uses, as mentioned earlier, I can see huge benefits from using Collaclot for primary wound management and surgical use, and I really hope you agree. The product is very easy to apply. It's been designed for the speed of application by anyone and not just medical professionals. The Collaclot sponge should be placed directly over the wound with a sterile swab behind to help maintain cleaner aseptic conditions. Further application of direct pressure should be employed where required and prior to any additional bandaging or dressings. So looking at the product itself, On opening the sterile pouch, the sponge has a smooth side and a rough side when viewed or handled. And this is a natural result of the manufacturing process. In practice, any side can be administered to the wound, but using the rougher side of the sponge will offer a greater surface area for the sponge to react with blood flow and slightly improve the clotting reaction time, as the sponge is effectively reactivating blood platelets. And during trauma and over time, blood platelets can become a little bit lazy, and the addition of the Collaclot sponge basically gives the platelets a gentle sort of kick up the backside to catalyze the clotting cascade. This process is improved due to the concentrated super collagen formulation within the sponge. So the speed of action. On a venous bleed in tests, Collaclot will control a venous bleed in approximately 3 minutes or less with direct contact and pressure as per any normal bleed control process. In an arterial bleed, it will also do the same over several minutes of contact and direct pressure, thus preserving life and stabilizing a patient prior to secondary treatment. Leaving the sponge in place for as long as possible obviously improves the clotting process prior to the product's removal. So when the entire coagulation process works properly, blood holds firmly together at the injury site and the bleeding naturally slows down and stops. The collagen sponge actively creates the clotting effect. However, the sponge will not adhere to the wound site or tissue. And when in use, it takes on the texture of a wet chamois leather, it's like a chamois leather when you're doing the car or the windows. So what we are not doing, we're not latching or sticking the product to any tissue, any veins or any arteries. We're just creating a faster and improved natural clotting process. An additional benefit from using Collaclot is that with careful removal from the wound, a newly formed blood clot is not disturbed and therefore no rebleeding occurs as a result. However, on removal and being a natural collagen product, any small fragments that remain will be absorbed by the body and metabolized as a normal physiological process. So onto the shelf life of the product and storage. Collaclot has an amazing shelf life of 5 years from the manufactured date and can be stored at temperatures of -10 to +55 and used in extremes of temperature from -95 to +55. It is therefore very good for use in countries with extremes of temperature. Competitor products are compromised by these factors and often very tricky to apply in normal conditions, let alone tricky conditions. Cost. I mentioned about the cost effectiveness of the product early on in the presentation. Currently, a 3x3 centimetre sponge is £5.95 per piece, and a 10x7.5 centimetre sponge is £19.95. This is significantly more cost effective than the competitors and is priced so that the product will be used for daily procedures within a surgery and not just there for emergency treatments. And the sizes have been put into place like this so that 3x3 sponge sits behind a 5x5 swab quite nicely, and the 10x7.5 sits behind a 10x10 swab quite nicely. The competitor products, I'll have to mention those. There are several competitor products, blood hemostats on the market, and these use ingredients like chitosan or kaolin to help promote coagulation. This, as we have seen from the test tubes, these just seem to plug a wound. They do work to a degree, but they don't react with blood in a natural physiological process, so are effectively a foreign body. And they will need to be completely removed, even if they do control the wound from bleeding. This removal and necessary cleansing process often creates a recurrent bleed, requires additional debridement of tissue, and displaces the body's natural process of clotting and wound repair. This is obviously a counterproductive process in respect of wound management and repair. But simply, Collaclot and Clot are scientifically more appropriate and characteristically more adaptable to use on a daily basis when compared to others on the market. So just to round up slightly, This was hopefully a very useful introduction to a novel new product that we believe will transform all aspects of bleed control, wound management, and surgical hemostasis across the veterinary and human medicine. In time, we are convinced you will see this product available across all medical establishments, first aid kits, workplace environments, and households around the world. It is essentially a layman's tool for accidents and emergencies, with scientific benefits that professionals can utilize to their advantage across multiple applications to preserve life and promote recovery. So, thank you all for listening to this webinar. I'm open for any questions that I can answer. Thank you very much.
Thanks, Alan. Can you hear me? Yeah.
Right.
Yeah, no, I mean, I will have questions, but I guess you've probably got them covered in some of the questions that you get frequently asked by the veterinary profession. But I mean, from my point of view, when I guess it was maybe, I think it was called Haemostop or something I used to use. And that had, you could put it in, but yeah, I would find that bleeding would keep coming through. So the kinds of things that I would use it in would be like dental sockets, particularly like your greyhounds. And when we used to do enucleation, there was something that you would leave in or have to remove just before you stitch up. So they're the kind of things that, you know, I would see myself using it for in practice. But when you open the smaller one and you only take can you just take a little piece out to do like for dental, and then will that keep, or once it's opened it's not?
Well, yeah, obviously it's a sterile product as it comes.
I'm just thinking for teeth.
Yeah, okay, yeah, well, yeah, what we've said, I mean, if you're doing a dental, a 3x3 piece, if it's a cat or a dog, depending on what teeth you're taking out, you know, you can, I'll show you actually, because I brought one along, obviously. So this is one of the large ones.
Yeah.
Just a sample product that I've got. So I said I may as well open it and let you have a look, because you only seen pictures of it. I think so. That's the product. You saw that on the slides.
Yeah.
And obviously this is the 10x7.5. It's a little bit flaky at the edges, but don't worry about that, because like I said, any little flakes that come off just readily absorbed by the body. So you can just break a bit off. Yeah.
Yeah.
If it was a 3x3 piece and you wanted a tighter bit for a cat, just take a bit, squeeze it into, roll it up if you want to, and put it into the cavity.
Yeah.
Same for enucleations in that respect. We know that this product will be absorbed. Now, the more you leave in, the longer that's going to take. That's the sort of obvious with scale.
Yeah.
But what we're saying is with enucleation, you do get quite a bit of bleed there. So put this on, get the bleed to stop, remove as much as you can, and then leave a little bit in, that's fine. It's not going to do any harm whatsoever.
Yeah.
So we've had those questions already sort of at London Vet Show last year where we launched the product.
Yeah.
And, you know, those things came along, and we know this could, you know, a piece like this inside a body would probably take about 2 to 3 weeks to be fully absorbed. But
that was my next question.
Yeah, it will be fully absorbed and metabolized as routine. Collagen is in every cell around your body. It's just going to get passed through it like a normal physiological process. Yeah. But obviously, we we don't want to say leave loads in if you don't need to.
No.
Sort of counterproductive. Obviously, it's got to be sterile as well when you're doing that sort of thing. So if it's going into an eye socket, then yeah, it's sterile. Then you're going to be sewing up. Then leave a little bit in, but yeah, there should be no issues. I take it on board. You'd be broad spectrum antibiotics straight following that as well for the patient. So there will be things going on there. But yeah, I mean, it is what it is. And you can tear it, you can roll it up, you can use either side of it. Doesn't matter. You don't have to think about it really. But obviously, the rougher side, if you've got a bleed going on, the rougher side is the better one because of the increased surface area where the blood can react with the product.
Yeah.
Yeah. Does that help?
Yes, that does. That does help. And in terms, because you were sort of saying, like in the case study you had with the horse, you said like a Collaclot dressing. Were you just meaning that they put like there's not like a dressing that's created for people that's different to that to put on it? You just mean they cut it up and they put it?
I just mean that I think she had probably two or three of these 10 centimeters. She put them on and got them held in
while they waited for the vet.
Yeah. And then obviously when the vet came, I mean, we spoke to the nurse. She said that the animal, you can imagine, it was just, its head was red when she got there. Put this on, and then at cleanup, there was no rebleed, and even during the stitch process, where you normally get bleeding happen with the sutures or staples, nothing. So the collagen had worked as it would normally do in a, you know, if it was just a standard, you know, paper cut, when you know, it takes a wound for the collagen to react with blood. So
I mean, the things that bleed, like, you know, a lot.
pads and stuff like that,
you
and
know,
tails,
pads, ears, tails, you know, those that tongues, you know, they're the things that come in that, you know, cover the surgery and blood. So if you're able to at least do something in that moment, because it's also, you know, it's dealing with the owner's hysteria a lot of the time as well, while you're getting things set up to move forward. But yeah, I mean, street vet, the reason, you know, we obviously kindly were given some pro bono for street vet. So, you know, that's for us to have more as an emergency kind of basis if we need it. So if we're seeing something and something happens, obviously that animal's going to be going into a surgery, but and referred straight in, but at least we can do something on the street.
It's just preparing the animal for any secondary treatment and making sure that the control, you know, if it's an RTA or something like that, it could be the difference between life and death. It could be, you know, and routinely some of those things are, but you know, I'm hoping that people use this for all sorts of applications, not just emergencies and surgical procedures, like you say, the dentals, the enucleations, and like you say, the people walking with the hematoma and the bleeding, the flapping their ears, and the tails are going. Control the bleed quite quickly, and obviously improve the healing process by using this product, and not just
reduce the mess for the nurses. They'll be happy with that.
And not just have it sat on a shelf for those emergency times. You know, we priced it so that it's so it leads to that. We want it to be on a daily basis. We don't want it to be sat there waiting for an emergency to happen. And, you know, and why would you? Like I said in the presentation, if you can speed up that control process, you're speeding up your surgery, you're speeding up so many factors, less anesthesia, you know, faster turnaround of the patient, all sorts of things. It just not the knock-on effect is just there to be seen.
No, Carla had asked about, sorry, she just put a question on what if it's an arterial bleeding, like a dog bite to the neck. Well,
again, I mean, you would do the same. If you can feed it into the wound, and hold it in place like you would direct pressure, but it will control an arterial bleed. Sort of in the main tests for this, in the main lab tests that were done, we actually severed the arterial bundle, the vein, the artery, and the nerve, the femoral bundle, should I say. And this product was put on through a pool of blood, as you can imagine, and it controlled that bleed in just over 7 minutes. So that wasn't just an arterial bleed, that was an artery, vein, and obviously a nerve that was there as well. And then it was kept in place, and sort of like, I think it was about half an hour later, there was a leg movement, no rebleed. And then an hour later, leg movement, no rebleed. And not just a little bit, it was, you know, a proper movement. So we know the product works. We know it can stop an arterial bleed, you know, effectively. And essentially that's going to save a life, because otherwise the animal or the patient would just bleed out.
Yeah. Okay. That is all of my questions. Oh, there you go. Carla's having a message, but thank you. Have you got any of your other frequently asked questions, or did I?
Well, yeah, I mean, the only other thing I was going to say is, I mean, BSAVA is around the corner. We're obviously going to be there. IMS are going to be there. We're going to be promoting this product again. We launched it at London Vet Show last year. It literally is that new into the market. You know, it's not in humans yet, and we're trying to get vets to give us some data back on the use of this. So if anybody wants a sample, come and see me, come and have a chat with me. I'll be there all the way through. Happy to answer any questions. Happy to take people's detail. If people want to use this product for dentals, straightforward. I mean, you know, all these things have been put back because of COVID and all the bits and bobs. So you know, now we're getting back into the main run of work again. Hopefully we'll get a lot more opportunity for this to be used.
Yeah. Well, I mean, obviously we've got it in our street vet backpack, but yeah, I mean, I'd quite like to try it in my work, to be honest. Certainly with dentals. But yeah, no, I'll come and see you anyway.
Yeah, I mean, on the equine side as well. I mean, doing a horse dental, you know, you need a good wedge to fit in a cavity of a horse where a horse has had a tooth removed. You know, it's quite a big hole.
Yeah.
And obviously, if you can control that bleed there, and then obviously stop more muck going inside, because that's some of the problems that they have, then you know, leave a good chunk in. It's not going to do any harm. It's only like having a gauze in there for any length of time, and it'll just get absorbed. Yeah.
Yeah, like a lot of people would like, I know where I worked before, we did quite a lot of dentals with greyhounds, and they were starting to sort of request being on tranexamic acid, like for a few days before and after. So I guess, you know, if this is an alternative, it would probably work out cheaper than having to have tranexamic acid.
Hopefully a lot cheaper.
For a few days before and after. So yeah, it's good to know about, definitely. Excellent.
Yeah, I don't think there's anything else really. I mean, you know, it is what it is. I mean, like I say, it's so new, it's so revolutionary. The science behind it is phenomenal. It really is. I just hope that, you know, it does exactly, well, I know it does exactly what we're saying it does, and it actually gets markets where it's going to be needed. Just, you know, people will ask, you know, the military are using this already. I don't think I'm out of place in saying that, because they know it's best in class. They've signed a waiver to say, you know, we'll take it because we know it's going to work. And with the kudos of the three major trauma professors of the UK, their backing of it. So it's off that the military has gone, okay, can we have some, you know, situation in the Ukraine at the moment, not to bring up politics, but you know, there's a big need for something like this.
Yeah, absolutely. Well, I'm delighted that we have some. I hope in the nice possible sense we don't need it on the street. Obviously. But yeah, it's definitely something that I think, you know, when people do watch this back, they will certainly see applications for it in practice. So yeah, that's great. And I will come and say hi to you at BSADA. But thank you so much.
We need to share that beer we've not had.
I know. Let's do that. All right, Alan. Thanks so much. Take care.
Okay, Jade. All the best. Thanks for what you need. Thanks for cheers.
Bye.
Goodbye. Thanks a lot. Can't see any closed at the share. And then see you now.
Stop recording.
Oh, why is it not stopping?